You know that feeling, right? That sudden, sharp twinge when you reach for something on a high shelf, or maybe it's that dull, constant ache that just won't go away. Shoulder pain is incredibly common, and man, is it frustrating. So today, we're going to decode it. And this is the question, isn't it? Is this something that'll just get better on its own, or is your shoulder trying to tell you something a little more serious? Well, let's dive into what the best clinical guidance says and find some clear answers together. All right, first things first, we need to identify the usual suspects. When it comes to that nagging shoulder pain, doctors have a pretty good idea of what's most likely causing all the trouble. So when you go see your doctor, they're typically thinking about four main possibilities. You've got rotator cuff problems, which we'll talk a lot about. Then there are glenohumeral disorders. That's a fancy term for things like a frozen shoulder. You could have an issue with your AC joint. That's where your collarbone meets your shoulder. Or, and this is a tricky one, the pain might not even be from your shoulder at all, but referred from your neck. But, out of all of these, rotator cuff disorders are by far the most common culprit. So what in the world is the rotator cuff? Well, think of it like a team of four muscles and their tendons. They wrap around the top of your arm bone like a cuff, and their main job is to keep your shoulder joint stable. See, your shoulder has this incredible range of motion, right? But all that mobility comes at a price. It's not a very stable joint. That's why this cuff is so crucial, and also why it gets injured so often. A disorder just means something's wrong. Either the tendons are getting pinched and irritated, which is called tendinopathy, or they've actually torn. So, how does your doctor figure out which one it is? Well, the assessment is kind of like a two-part investigation. First, they're going to listen really carefully to your story, and then they'll do a physical exam. And honestly, your story, it provides the most important clues. So what can you expect them to ask? They're basically trying to build a unique profile of your specific pain. They want to know things like, when did it start? What does it feel like? Is it sharp? Is it dull? Did you fall or injure it? How much is it messing with your daily life? Like, can you still brush your hair or lift a gallon of milk? Does your shoulder feel stiff or maybe like it's going to pop out? They'll even ask about your general health, your job, and what sports you play to get the whole picture. Okay, so after they've heard your story, the next step is the hands-on examination. This is where your doctor starts gathering the physical evidence to either confirm or rule out what they're suspecting. And the exam itself is a pretty simple three-step process. First, they'll just look at both of your shoulders, comparing them to see if there's any obvious swelling, muscle loss, or if something just looks out of place. Then they'll gently palpate, which just means press on different parts of the joint to find exactly where it's tender. And finally, the movement tests. They'll see what you can do on your own, what happens when they move your arm for you, and how you do when you push against their resistance. Each little step provides a vital clue. Okay, before we even start talking about treatments, we have to cover something that's absolutely critical. Most shoulder pain, thankfully, is not an emergency. But some symptoms are definite red flags, and if you have them, you need to seek medical help right away. So please, listen closely to this next part. These are the urgent warning signs that you really shouldn't ignore. Let's walk through these. If you have a significant injury, like a bad fall, and you have immediate pain and weakness, that could be a fresh tear of the rotator cuff. Any kind of unexplained lump or swelling in the shoulder area needs to be checked out immediately. If your shoulder is red, hot, and severely painful, especially if you have a fever, that's a huge warning sign for a serious joint infection called septic arthritis. If you had a trauma and now you can't rotate your arm and it looks deformed, it could be dislocated. And finally, if you suddenly have pain and swelling in several joints at once, that could point to a bigger inflammatory issue. Seriously, don't wait on any of these. Okay. So, assuming no red flags are present, what does that road to recovery usually look like? Let's use the most common problem, a rotator cuff disorder, as our example. The approach is usually pretty conservative and methodical, which is good news. The initial plan is the simple three-pronged approach. Step 1, modify your activities. Now, this doesn't mean stop moving entirely. It just means avoiding the things that really aggravate it, like reaching way overhead. Step 2, get the pain under control so you can actually move gently. And step 3, start a structured physiotherapy program. See how they all work together? You need all three. Now, when it comes to pain relief, the guidance is pretty clear. Start simple. Regular paracetamol is the first thing to try. If that's just not cutting it, your doctor might then suggest an anti-inflammatory like ibuprofen or maybe codeine. But that's only if it's the right choice for you and if the first option didn't help. So what is physiotherapy really? It's not just a sheet of random exercises. It's a targeted program, usually for about 6 weeks, designed to fix your posture, retrain how your muscles fire, and gently stretch and strengthen those specific rotator cuff muscles. And here's the key. It's all about low-intensity, high-frequency exercises. You're doing a little, but often, and always staying within a comfortable pain threshold. And if it's helping, you might keep going for another 6 weeks. And this brings us to what's really at the heart of modern treatment: shared decision-making. This isn't something that's just done to you. You are an active partner in your own recovery. The best management plan is always going to be the one that you actually understand, you agree with, and you can stick to. But what if physiotherapy and pain relief just aren't cutting it? Well, you've probably heard about steroid injections. They can be a really powerful tool for some people, but it's important to know they aren't for everyone, and they're definitely not the first thing to try. If you remember one thing about steroid injections, please make it this number: 2. That's it. The guidelines are super clear that you should not get more than 2 injections in the same shoulder. The biggest reason is that over time, they could potentially weaken the tendons. And of course, like any medical procedure, there are some potential side effects. Your doctor will talk you through all of them. Things like infection are rare but possible. There's also a risk of tendon injury or a temporary spike in pain right after you get it. And it's really important for people with diabetes to know that it can make your blood sugar go up for a little while.
So the decision to go ahead with an injection isn't random at all. There's a clear logic to it. A doctor might consider it if you had a great response to your first one, or if your pain is so bad that you can't even do your physiotherapy. On the flip side, they'll usually avoid it if a past injection did absolutely nothing, if you've already hit your limit of 2, or if there's any reason to suspect an infection.
So at the end of the day, that pain in your shoulder isn't just some random annoying thing. It's a message. It's your body telling you a story about how you move, how you work, maybe even how you sleep. And by understanding the causes, the process, and the treatments, you're not just getting rid of pain, you're learning how to listen to that story.